Blog Talk Radio.
This is the Doctor Authority Network, on air with host Mark Wilhelmsen, where we bring together influential doctors and dentists to discuss their innovative practices and unique approaches to treating their patients.
Welcome, everyone, to the Doctor Authority Network. My name is Mark Wilhelmsen, and I'm excited to be joined tonight by Dr. Andrea Joy Smith, who is a Sacramento, California-based dentist and author of the upcoming book titled In the Chair with Dr. Smith, Treating More Than a Toothache. How are you doing this evening, Dr. Smith?
I'm doing very well, Mark. How are you?
Awesome, thank you. Before we begin, can you provide some of your background here for our listeners, how long you've been in practice, and also perhaps tell us a little bit more about your upcoming book?
Absolutely. I am a practicing dentist in Sacramento, California. I attended the University of California, San Francisco to complete my dental training. That was in 1994, so I've been practicing for a total of 20 years. During that time, I've provided very unique services to my patient population, such as mini dental implants, which is a newer technology for placing implants in patients, and also another unique service that I provide is a different surgical technique for treating receding gums.
And implant dentistry has been around for a fairly long time, and I think a lot of people's impressions are that it's very costly and time-consuming process. So, are the mini dental implants a new technology that you'd like to talk about a little bit here?
Absolutely. Mini dental implants are a new technology that has come out of the need for patients and clinicians to seek minimally invasive treatments. Traditionally, when a patient needs an implant, there's often a need for bone grafting and some rather invasive surgery. And in that technique, basically, we are sort of manufacturing bone to fit a preformed implant. In the case of the mini dental implant, we have patients that have very minimal amounts of bone due to the loss of teeth at an early age, and people that have been missing teeth for more than 3 months, frankly, lose a lot of the bone that goes along with that tooth. And so by doing a mini dental implant, finding an implant that will fit the existing bone, we can cut down on some of the invasive surgery of bone grafting, and we can place that implant the same day in the amount of bone that's available.
And the look and the feel would be similar or the same to conventional implants?
Yes, the look and the feel and the strength and the longevity is very comparable to conventional implants. Yes, it is.
So would I be correct in saying that not everyone is a candidate for conventional implants? How does the new technology really impact people who want to receive mini dental implants, and why exactly?
Yes, you are correct in saying that not everyone is a candidate for conventional implants. If you have lots of missing bones, if you have some medical problems that sort of compromises your ability to heal, then doing invasive surgeries like bone grafting, where we place synthetic bone materials and we expect that to integrate into your bone to provide the stability for the implant, or for patients who have a lot of bone missing and would need the invasive surgery of moving a part of their jawbone or hip in order to get a big block of bone that will be placed in that deficient site. So patients that are medically compromised, of course, we don't want to put them through those types of invasive procedures. And with the mini dental implant, we can use a smaller implant and achieve the same results. And so this
can you take us?
Mm-hmm. Sure.
Yeah, I'm sorry, go ahead.
I was just going to say this opens up implant dentistry to patients who cannot receive either the invasive treatment or also afford the more expensive procedure of placing traditional implants. Traditional implants are typically done in several stages. The first stage is to place the implant inside the bone, and then it is left to integrate with the bone buried under the gum tissue for a period of 3 to 6 months. After that, additional parts need to be added to that implant in order to put a tooth or dentures or some type of restoration on top of that implant. With the mini dental implant, it's a one-piece unit, meaning you have the part that's embedded in the bone, and you also have the part that is left above the bone in order to support the restoration, either a crown or a denture. And so with the one-step procedure of placing a one-step implant, as long as we are able to place it in the bone tight enough, we say with enough torque, to be technical, we can then load that implant the same day without having to leave it buried, unused for that period of 3 to 6 months.
So the technology seems to be a very innovative way to treat the common problem of missing teeth or loose dentures. Are there any other new dental procedures for other common problems?
Yes, there are, and you're absolutely correct that it's a new way of treating that common problem. Another common problem that we have in dentistry is the problem of gum recession, and people usually refer to it as people being long of tooth, meaning your teeth start to look longer than they originally were. And what this accounts for is the fact that the gums have receded or grown away from the actual crown of the tooth, and then it exposes the root of the tooth, which is normally embedded in the bone. And so the tooth appears to be longer, but indeed you've lost bone and gums that support that tooth. And so there's a new technology called the pinhole surgical technique, and I will abbreviate it PST for pinhole surgical technique. It was invented by a doctor named Dr. John Chow down in Alhambra, California. He is a practicing dentist and has practiced and taught as a professor at the University of Southern California. And back in 2000, he developed this technique where he can very minimally invasive, in a minimal way, move the tissues back down to their original position without having to cut the gums open and, as we would say, flap them back or peel them back, and then place other tissue that has been taken from the palate into that site, and then flap that tissue or fold it back over and suture it into place. That's how it's conventionally done. You'd have two surgical sites. The initial site where the tissue was rolled back to expose the root, and then the palate where we'd have to harvest some tissue from in order to cover those roots and then suture those gums back over it. This technique calls for a small pinhole to be inserted right in what we call the mucal fold, or in the fold of the gum where the lip meets the gum under the lip there. And that pin is inserted, and the tissue is brought down with a special instrument that enters that pinhole, and it drapes that tissue down rather than having to surgically open it. So we do everything from the inside. And so in that case, there's no need for incisions, just a little small pinhole. There's also no need for sutures and things of that nature. So that is a very...
So it seems to me that the recovery time would be much less then. Absolutely.
The recovery time is much less. While it does take the 6 weeks to reattach the tissue to the bone, the immediate results of the covered root structure, it's immediate, and you don't have the pain, you don't have the traditional problems or surgical complications that you might have with sutures and having secondary tissue placed in an area where it normally is not found.
And as far as gum recession is concerned, how does that originate? Is that from lack of flossing, or is there something more to it?
Yes, it originates from several things. Lack of flossing is one of those. When patients don't floss regularly, they can develop gum disease, periodontal disease as we call it. And as a result, the gums can slowly recede in order to sort of move itself away from the areas that are not brushed and flossed regularly. That's one way that patients can get gum recession. Another way that patients can get gum recession is by brushing their teeth too hard. Right at the gum line, they're putting too much pressure on the teeth, and they're abrading the gums. They're abrading the teeth, and the gums just want to grow away from that area and expose those roots. And then a final way that patients get gum recession is through grinding their teeth. A lot of people that grind their teeth do so at night when they're not aware of it. And so the grinding and the extra pressure that's placed on a tooth can also put stress on that tooth and stress on the gums, and those gums, again, just want to grow away from the area where they belong.
You know, one of the things that stood out to me, and one of the reasons I wanted to interview you, was when we were initially talking, and we're actually talking about this particular technique. And if I recall correctly, you're one of only, I think, 600 people who are 600 dentists, I should say, who are certified to perform this particular technique.
Yes, that is correct. As I was saying before, Dr. Chow invented this technique up in the year 2000, and in 2006 he perfected it and the instruments that treat the problem in a 6-year period. So in 2006 he then applied for FDA approval, and he obtained that approval not until 2012. And so after 2012, he decided to start teaching other dentists. And because the technique was invented by him, he wanted to be hands-on in training doctors. So in late 2013, he trained his first group of doctors in October of 2013, and I was trained in early 2014. And at the time when I was trained, there was about 200 doctors trained at that time, and so now we're in December of 2014, so I believe he's gotten up to about 700 doctors by holding special seminars twice a month for about 30 to 40 doctors per seminar.
What I like about both of these techniques, and it seems to me that it's not only helpful in the recovery times, but also it seems to me that the cost is also something that it's probably much easier on people. I mean, obviously, if it's quicker, then it should be, I would think, relatively a little bit less expensive. Is that true, or is it sort of the opposite, where there's a shorter period of time of recovery, and so it is comparable to conventional?
No, actually, I would say the mini dental implant is about half the cost of a traditional implant, mainly because there's not multiple parts, and the parts are just a lot less expensive. The way they're manufactured is completely different than the way traditional implants are manufactured. A traditional implant has many more moving parts, and so we can place a mini dental implant at about half the cost just because the supplies and the technique of placing it in is just a lot simpler. And as far as the pinhole surgical technique, it might not be quite 50% of conventional periodontal surgery, but it's probably, I'd say, at least a third less, because it requires less surgery time. That's incredible, and I think that's something that I think a lot of people have anxiety about with going to dentists, is the cost of these types of things. So can you tell me a little bit, and we briefly touched on it a little bit, but can you tell me why somebody would even choose to have a conventional implant put as opposed to a mini, or is it more of an awareness thing? They're just not even aware that it's even around. I think that it's more of an awareness factor. When traditional implants or conventional implants were first introduced to the market, they were introduced mainly to oral surgeons. And oral surgeons were the primary dentists that were placing mini dental implants. And later they opened the field up to general dentists. And so that technique has been around at least 30-plus years. The concept of the mini dental implant was developed by a doctor named Dr. Sindax, and he did a lot of trials because it took a long time for conventionally trained oral surgeons and dentists to believe, really, that the mini dental implant can serve a similar function as a conventional implant. And so when there's marketing or when there is offering of an implant service, you normally would find that the mini dental implant isn't really considered by oral surgeons or dentists that have been placing conventional implants for a long time, just because it's a tried and true technique that they've used for years, and they view mini implants as something that is too new to, stake their procedures on. So it's awareness. There are some reasons, I really can't think of any, why you would choose a conventional over a mini. Maybe if you had just an extraordinary amount of bone and a lot of forces on your teeth. You're a heavy grinder. Like I said, people grind at night and they're not aware of it. And if you fracture your own teeth because of that, because there are patients that grind long and hard enough to do that, then you might want to consider conventional. However, any implant, whether it's a mini dental implant or a conventional implant, taking an abnormal amount of stress can fail. Implants in general have about a 95% success rate, and that's true for the conventional as well as the mini dental implant. And so there are times when mini dental implants and conventional implants don't work out for a patient. I'd say that 5% of the time, but for the most part, I've been placing these mini dental implants since about 2007, and I find that my success rate is definitely comparable to the conventional implant.
Well, it's stood the time test there. I mean, that's what is that, about 7 years now? So
yes,
how many of these implant procedures have you performed in those 7 years? Do you know? Probably over 1,000, I would think, by now.
Yeah, well over 1,000. I'm probably fast approaching 2,000. When I initially started doing the mini dental implants in 2007, I started doing them mainly to stabilize dentures, because patients that wear dentures always complain about having to wear Fixodent and constantly adjust the Fixodent so that they can eat and function properly. And so mini dental implants, sort of as an entry into the market, I believe many of the mini implant manufacturers thought that would be a great entry point into the market. And so I started placing them, and I did that for about 2 years. And then in 2009, I obtained advanced training, and I actually attend advanced training twice a year, even to this day, just because things change a lot in dentistry and any other profession, as you can imagine. And so starting as an entry point to stabilize dentures, but then as the technology has advanced, and also as the studies, long-term studies of 10 and 15 years of multiple implant placements have stood the test of time, more and more companies are actually starting to manufacture small diameter implants. But I have to admit, it was probably, to stabilize dentures was that entry point into the market. And once they earned their reputation there, it was a natural progression to do full mouth reconstruction or single tooth replacement. It was the natural progression. And I've done a lot of both, full mouth reconstruction as well as single tooth replacement and of course, stabilizing dentures.
It sounds like the full mouth. It kind of brings me to my next question, because when I was doing research on you, one of the organizations that you're a part of that kind of caught my eye was the Dental Organization for Conscious Sedation. So when you're doing a total mouth, makeover, is that something that, how long would that take, and is that something that would be more of a, well, can you actually just go into that a little bit about the Conscious Sedation Organization? Because that's a very interesting title.
Yes. The Dental Organization for Conscious Sedation, also known as DOCS, is an organization that was formed by dentists as we realize that there are over 50 million Americans that are fearful of going to the dentist. And a lot of these patients aren't really candidates for IV sedation or general sedation to have routine dental procedures performed. So oral conscious sedation is a milder type of sedation. However, we still achieve, I'd say, sedation, which means sleep. And we also are able to achieve an amnesia effect, which is an effect of when patients have surgery, they often come out of surgery not remembering exactly what's transpired. So the combination of medications that we use allow them to start the sedation process the night before, because a lot of times patients that are fearful of coming to the dentist and they know they have an appointment the following day, they stay up most of the night worrying about it. So we start them the night before with some diazepam, also known as Valium. So that Valium gets them through the night, and they wake up the next morning, and we have them take another medication an hour before coming to the office. And that is in the family of Valium, and it's called triazolam. They take a small amount of that tablet an hour before the visit, and they have someone to drive them to the office. And so once they get to the office, they're able to walk in on their own, although they are starting to feel the effects of the medication. But they walk into the office, we're able to get them seated in the chair, and then from that point we administer 2 additional medications to achieve the sedation required to perform the procedures. And yes, when I do a full mouth reconstruction case where I am extracting upwards of 20 teeth and placing upwards of 20 mini dental implants and replacing them with some type of a temporary denture or some temporary teeth, it's about a 4-hour visit, and the patient is basically sedated the entire time. We still use local anesthesia, or lidocaine, or Novocaine as people called it back in the day, but we still use the local anesthesia because that patient is really able to maintain their own airway, meaning they can breathe on their own. And if I really needed to arouse them to get their attention, I could do so by either enacting a reversal agent or just a little bit of a sugary drink just to sort of spark a little bit of arousal. But they normally fall right back to sleep as soon as we've gotten them to cooperate. And so that's why it's called oral conscious sedation. They're not completely unconscious, and it's a safe level of a combination of oral medications without having to use IV, and we can achieve lots of dental work and while they are sedated and feeling comfortable receiving the treatment.
I think the fact that you are able to address that anxiety that people have and that phobia, that I would address as a phobia too. I think a lot of people have a very real phobia of that, and giving them that option is fantastic. Not only that, but also with the other techniques and being able to offer them alternative methods of doing it that are actually more, because I'm sure probably part of their anxiety stems from the cost too. So you're able to address, sort of all of these issues, which is fantastic.
Yes, absolutely we do. I find that my patients that have been to other places being offered conventional implants, they are often pleasantly surprised with the price, with the reduction in price, and yet receiving a very comparable result.
And it seems to me a faster recovery time.
A much faster recovery time. Patients that receive conventional implants definitely have to go through many more weeks and sometimes months, sometimes up to a year, to really recover from the placement of that implant by the time it's uncovered, restored, integrated, and things of that nature. So we are able to save patients time, recovery time, money, and save them from invasive techniques.
Well, that kind of brings me into, I'm sure you have a lot of stories from a lot of patients who have been transformed by being treated, especially when they're having loose or missing teeth, and really how that can affect somebody on so many different levels, not only in appearance and I'm sure they have a lot of insecurities around it. I want to kind of talk about your book a little bit in the sense that you most likely, I'm sure, have a lot of stories. And can you tell us a little bit more about the book, what the premise of the book is, why you wanted to write it? And time is absolutely flying. We're literally down to a little bit more than 5 minutes. So I'll just ask you to touch on that book a little bit and tell us about it.
Okay, I think I can get it in. The book that I'm writing is called In the Chair with Dr. Smith, Treating More Than a Toothache. we find that our patients come in, of course, with dental problems, but there's a story with every patient as well. And as I started talking to my patients, I actually feel like I have little short mini visits with my patients. That's the period of time where we develop mutual trust, and I find that if I am able to glean a little bit of their story and how they came to be at the dental health position they are now, whether it's dental health or not being very dental healthy, if I can figure out where they came from, I can then start to formulate my treatment plan to address their needs, but also to address any issues that have kept them from attaining the dental health that they want and deserve. And so I wrote this book because there's not a lot of books out there. Most books written on dentistry are for dentists for various reasons. It could be technique books, it can be marketing books, or something on how to grow your practice. But there's very few, and in fact, I'm actually not aware of any book that's out there that patients can read and get some valuable information. Of course, it's not intended to diagnose or treat any person's problem, but when I relate stories about patients' backgrounds, what they've gone through, other patients will be able to read those stories, and they'll realize that they're not alone and that there's definitely hope for treating their problem. A lot of patients walk in thinking that they have the most terrible dental health in the world, and I usually find that that's not the case. But a lot of times they have felt reprimanded or scolded by their previous dentist because they haven't taken the care of their teeth that they would have hoped to. So this book really explains very common dental problems and lots of extraordinary stories told by ordinary patients, as well as it goes over a lot of emergency scenarios. There are patients sometimes that their jaw is swollen, they don't understand why, or their tooth feels sensitive to cold and they don't understand why. So I answer about 101 common questions and I give answers to those questions that every dental patient really needs to know. So from that standpoint, of course, there's a lot of the information about, how many teeth we have and things of that nature, but the book is really about the patient being able to pick up a source. And so if their doctor tells them, for instance, you need an MO filling on tooth number 31, well, with the information in the book presented in the way that it's presented in, they'll know exactly where tooth number 31 is. They'll know exactly what an MO is, and they'll know which type of filling could be used and on all of their options. And it's presented in a very patient-friendly manner, and it's just a good book of information.
Well, I salute you for doing. I mean, in all sincerity, I salute you for doing a book like that. I just think a lot of people are not really understanding of how many different areas of your life that neglecting your teeth can affect. And can you give us sort of a really kind of a brief summary of if you're starting off from as a child and you really don't take the health your teeth seriously, you don't floss. What is your life going to look like? To me, it seems as though you're gonna have exactly what you're talking about. You're going to have the tooth loss. You're going to have the gum recession. You're going to have all these different issues, but that plays into so many more parts of your life, doesn't it?
Yes, absolutely, it does. First of all, it affects your confidence first and foremost. If I can't tell you how many people come in and they automatically put their hand over their mouth, or when you ask them to smile, they have somehow trained their lip to cover that missing tooth. I can't tell you how many people there are. So the confidence alone is taken away when you have lost the proper aesthetics of your teeth. Secondly, there is all types of research now linking the bacteria that are typically mostly found in the mouth at a moderate level, when they're allowed to overgrow, when patients don't floss or don't brush adequately, those bacteria make their way into the bloodstream, and they're causing plaque to build up in the coronary arteries, and they are contributing to heart disease. Also, patients with diabetes, if they don't have a healthy mouth, their body is really busy trying to control their blood sugar, but if they've got a lot of infection going on in the mouth, the body needs to put some effort into doing that also. So that blood sugar is not going to be as controlled if your mouth is unhealthy versus when your mouth is very healthy. The body can spend its time controlling the blood sugar rather than trying to control the blood sugar and control the plaque level in your mouth and things of that nature. So it definitely affects your entire health. It's not just about teeth, and that's why the book is called Treating More Than Toothaches. We have toothaches, yes, but if left to its own devices, dental decay can lead to hospitalizations, death, and other things of that, and systemic diseases, chronic systemic diseases that can last throughout your entire life. It contributes to a lot of that.
Well, listen, we are, unfortunately, we're out of time. We'll have to have a part 2, I think. So if the people want to get in contact with you, I have the website at smileagainnow.com. And I really thank you for taking the time to speak with us today, and have a great night.
Thank you, Mark. It was my pleasure to do so.
Thank you. Bye-bye.
Thank you. Bye-bye now.